What we're going to be doing on this program is looking at the situation in India, particularly in Delhi, but also looking at the situation in the United States. And to that end, we've got some of the finest doctors from the United States and from India. Dr. Suresh Kumar, Medical Director of LNJP Hospital with us. Dr. Rajesh Parikh with us as well, Director of Medical Research at Lakh Hospital, Mumbai. Joining us from the United States, Dr. Rajveer Purohit of the Mount Sinai Hospital, Dr. Eshita Dwivedi. She's an MD in cardiology at the New York University Medical Center, and Dr. Kanika Monga, internal medicine at Texas Medical Center in Houston. I'd like to thank all of you very much for joining us. Dr. Kumar, let me come to you first. It's very sad, Dr. Ashim Gupta, one of the doctors who worked with you and under you, passing away of COVID. What do you believe was the problem? Was there improper PPE use, or what exactly were you able to contact trace? What are some of your findings so far in the death of this one wonderful doctor?
If you see this pattern of disease evolution and the infectious, it's a highly infectious virus, and Dr. Ashim Gupta was working in the ICU of our hospital. He was very dedicated doctor, and if you see that viral load is very high in ICUs, because these are the critical areas. If you see the patients, one in the general ward and one patient in the ICU. So in ICU, the viral load is high. We have all this infective material coming out of ventilators, and all the secretions are much more than in the general ward. So the staff, one of our technician also lost their life few weeks back, and this is the second casualty. We are very sorry that we have lost one of the brightest doctor of our hospital. He was doing shift duties, but still we need to have more protective measures. And as we see that deaths are also there in the Europe, in the USA, and all over the world, that doctors are losing their life in fight against this deadly virus.
Yeah. Dr. Kumar, just on a personal note, can you tell us a little bit about Dr. Ashim Gupta? You've spoken about his work. What was he like as a human being?
He was a wonderful human being. He was always helping the patients. And he came to me just before his illness that please keep me in this policy matters, in the evolution, the strategy to how to control the infections in the ICU. And he was worried that we have the large number of patients coming to the LNJP hospital. So we said that as with the unlocking of the situation was very severe, and he said that number of cases are increasing. He was worried about the epidemic, and he was having very human touch with the patients.
In fact, those images that we just showed were of my colleague Sukirti interviewing him a few weeks back. It's so very devastating to see such a fine doctor lose his life over there. He was in that interview. He was talking about the fight against COVID, and now he's gone. It's so very sad indeed. Dr. Parikh, Director of the Medical Research at Lakh Hospital, thanks for joining us. You know, things are changing in Mumbai. On the one hand, there is some cautious optimism. There is more opening up today because people can go to salons for a haircut. Does that actually make you worried now? Because if you look at what's happened in Delhi, once we opened up, we've seen a huge spike in numbers. So now Mumbai has to at some stage open up. But just by opening up more over the last few days, including today, is that something that concerns you as a medical practitioner?
Yes, Vishnu, it concerns me deeply. Thank you for having me on your show and for your kind words of calling me one of the finest doctors in the world. I'm not sure if I can live up to that, but you certainly are one of the finest anchors in the world. Vishnu, I'm not surprised at what's happening all over the world. You know, in the first week of March on primetime television, when the total number of cases in India were 84 and the total number of cases in the United States were less than 100, I displayed a chart in which I showed that our testing rate was 6,000 per million. And I said that the US's testing rate was just as abysmal as ours at 7,000 a million. And I pretty much in early March predicted the situation today to the extent that the anchor kept interrupting me and saying, Dr. Parekh, you're scaring us. Today, I get a lot of calls in an absurd way, congratulating me on the prediction. You know, a medical person can never celebrate a terrible prognosis. We do celebrate our good prognosis, but when terrible things happen, we don't take solace in thinking that we were right, but, wish that we were wrong. So I wish I was wrong. And so looking ahead, and you see, both our countries have been affected at 6,000, 7,000. The United States is currently testing almost 100,000 per million. And in India, we are testing about 6,000 per million. The real figure is not the number of tests, but the number of tests per million. And so, we're going to see a lot more as the cases ramp up, as the testing ramps up, I apologize. And as we open the lockdown, as has happened time and again all over the world, I mean, look at the 5 states that are the most affected. You mentioned them, Texas, Florida, Georgia. These are states which did not follow the guidelines for lockdown.
Yeah. In fact, I just wanted to go across to Dr. Kanika Monga on that. Dr. Monga, is there a real possibility that many of the states that were just being mentioned might actually have to shut down completely because of this huge uptick in numbers, 45,000 in 24 hours in the United States?
Yeah, thank you so much for having me. I'm sorry to be here at this time. Yes, so definitely the worry is that with the cases rising, Houston becoming the new epicenter, there has to be call for action to mandate a stay-at-home order again. We did that in the past in March. This time it's way worse than what it was the first time around. It's very difficult for local authorities like our judge in the county. They can make recommendations for patients to stay at home, socially distance, but unless it comes from the federal government or our governor as a state, we cannot enforce a stay-at-home order, which I see coming definitely in our near future.
Yeah. Dr. Dwivedi, in terms of the road ahead for the United States, is there a real sense that with the testing being as high as it is now and perhaps getting higher over a period of time belatedly, that these numbers might actually rise?
Thank you for having me, and hello from New York. I think there's 2 different things here. One is how much we're testing. And obviously with the higher availability of the test in general and more accessibility, obviously we're going to see a larger number of tests. But the question is how many percentage of those tests are coming back positive? Now, having taken very stringent measures in New York, we're actually finding that the percentage of tests that are positive has gone down drastically. Whereas in the southern states where perhaps, some of the measures were not as stringent, we're actually seeing that the number of hospitalizations are rising. In my hospital itself, we've seen a drastic decline in the hospitalization. So I think we have to focus on the number of positive tests and the number of hospitalizations that we're seeing from this coronavirus.
Yeah. Dr. Purohit, in terms of medicine right now, there's been a lot of hope attached with remdesivir, a few other drugs as well. They aren't cures by any means, but they do have an impact in certain cases. Plasma therapy here in India appears to offer a great deal of hope. And then, of course, there's the entire battle to get a vaccine. What in your assessment is showing the maximum promise, and by what stage, and give us an idea of months, do you expect to actually see a vaccine being deployed around the world?
Well, first, Vishnu, thank you for having me on, and good evening to all of your viewers in India. Obviously, at the end of the day, the vaccine is going to be the solution. And unfortunately, the vaccine still has time to be tested. I think they're still in the early phase trials of the vaccine and haven't yet tested it on larger populations. My own sense is that if we get lucky, we'll have a vaccine at the beginning of next year, 2021. I think probably a more realistic assessment will be in the middle of the year and maybe even later than that, depending on what the results of the early trials show. What we're learning about the disease, though, in the short, before we do the vaccine, if we talk about the kinds of treatments available, we're learning that the vaccine is far more sort of insidious than we initially thought. So at Mount Sinai, for example, patients who get admitted for COVID are all put on anticoagulation. And we found that this is really helpful for patients because there's significant thrombotic disease and clots that form, which actually are one of the major causes of morbidity and mortality in these patients. So the disease affects a whole host of systems. We do have some treatment, as you had alluded to, such as remdesivir and plasma therapy. I think they sort of work at the margins of the disease and they help. There's good data showing that they're helpful. I don't think they're going to be the solution. I think at the end of the day, it's going to be a combination of prevention and the vaccine that'll solve our problems.
Yeah. Dr. Kumar, there's a sense in India, I mean, it's been spoken by some, that the virus is less potent in India, and it's because of that our fatality rate is lower. And the rate of people getting better is relatively positive. Is that your belief as well, or is the strain of the virus in India as dangerous as it appears to be in, for example, the United States or Italy earlier on?
You are right that case fatality ratio or deaths are less in India. Earlier it was 1.5 to 2.5% in most of the centers. But over the last 2-3 weeks, we have seen the surge in the number of deaths, and it has gone up. In some centers, it has gone up to 3 to 4%. And in our center also, it's a little bit higher, touching around 3%. So this has happened all over the world. And if we compare our death rate with the United States death rate, where death rate is 8% or even higher. So our death rate is still less in the Europe and in the Western countries. One of the reasons of this is that the profile of patients is little bit different, and we have the regional differences also, and some change in the virus also. So different strain may be one reason for that, and different region have different death rates. That we can have more epidemiological studies on this.
Sure.
And as the disease is evolving, and more patients we are having, death is little bit on the higher side.
Okay.
In all over the world.
Sure. Dr. Monga, in your experience, what is it that we are now learning about the disease? I mean, the entire concept of taste being affected, smell being affected in certain cases, how it moves around the body, the organs that it impacts. We've seen this Kawasaki syndrome among children as well. What are some of the new findings associated with COVID and its spread within the body?
So, this virus is really impacting different parts of our body. Someone mentioned blood clots, thrombosis, patients are presenting with strokes. Others, what I'm noticing and what I'm seeing while talking to my colleagues is a lot of the patients are now younger, especially during this, this time compared to before. They're younger, and a lot of them, while they do have obesity or diabetes as comorbidities, some of them are perfectly healthy, yet coming into the hospital and are very sick. Of course, the lung manifestations we're seeing rashes, we're seeing patients with all different types of infections, whether it's a urinary tract infection, and then tracing it back to COVID-19. So basically what I'm seeing now is that it can impact any part of the body. So not to ignore symptoms if they don't sound like the typical disease as it did in the past.
Yeah. Final word from you, Dr. Dwivedi. Is that what you're seeing as well? A whole lot of related or comorbidities associated with this infection of COVID itself, different parts of the body being impacted, something which you didn't expect?
Well, it's, as a cardiologist, I have seen a lot of cardiac complications from this disease over the past 3 or 4 months. Having said that, the virus essentially causes inflammation, and that inflammation can impact literally any part of your body. Give it your heart, your lungs, obviously, your kidneys. We're seeing a lot of patients with neurological deficits. Some people have hearing loss from this virus. So it's sort of, a panorama of complications and sequelae of the disease. So it really doesn't spare any organ. Even you can have dermatologic complications from this. So the inflammation that's underlying is really the cause of, the long-term effects on the body.
Yeah. Well, I'd like to thank you all very much for sharing your experiences in the United States and here in India in tackling what is a global menace to all of us. Thank you so much.